Doctor, why do we check the fallopian tubes in infertility patients? And what are the methods to check the fallopian tubes?
In a person who has infertility, the following factors are checked. One is the seminal analysis, the second is the ovarian function, the third is the uterine function, the fourth is the hormone function, and the fifth is the tubal function. When we come to the tubal evaluation or tubal function evaluation, there are essentially three ways of checking the fallopian tube. One is by Histosalpingography, second is by laparoscopy, the third is by Sonosalpingography. These are the three methods that are used to check the fallopian tubes. When it comes to Histosalpingography, it is the simplest investigation available to check the fallopian tubes. It is usually done by the radiologist or by the gynecologist, and it is done in the following manner as part of the evaluation. It is usually done in the first 10 days of menstrual cycle and is done by taking an X-ray after injecting a dye into the uterus and tubes. In these situations, an antibiotic is given before the procedure so that there is no risk for infection. The information we obtain with the histosalpingography is: one is uterine cavity abnormalities, two, the tubal outline, whether both tubes are normal or abnormal, third is free flow of dye. So essentially, HSC or histosalpingography checks the uterine cavity and the tubal patency. In relation to the second investigation which I mentioned, that is the laparoscopy, this investigation is done under anesthesia. It is done when the period of infertility is longer or when the X-ray or HSC is abnormal, or when there is a previous surgery on the abdomen like cesarean section or ovarian tumor surgery or appendectomy or uterine surgery. In these cases, a laparoscopic investigation is preferred. What exactly happens in laparoscopy is, under anesthesia, a video telescope is passed to the umbilicus. Then the uterus and the tubes are visualized directly and assessed in terms of their function and anatomical position. In other words, what we see is the relation of the fallopian tube to the ovary is checked, whether both ovaries are normal size, and then tubal patency is checked by a process called methylene blue test, where dye is injected. If everything is normal, it is reported as chromotubation normal. Sometimes if one of the tube is abnormal, we try to re-inject the dye and then assess the information. And sometimes if there are any abnormalities like small bands of tissues, these are removed and the tubal function is restored. In relation to HSC and laparoscopy, there is a third method of ultrasound that is used, but it has its own limitations and benefits, and it is also called as Sonosalpingography, saline sonography, or hycosci. The advantages are, it's a simple test which can be done in the OP, where uterus and fallopian tubes are checked, but it has lot of limitations. If the test is positive, it is good, but if the test is negative, it does not mean anything. Then a laparoscopy is done. These are the basic tests for evaluation of the uterus and the tubes, more so the fallopian tubes. The tests which I mentioned are HSC, laparoscopy, sonosalpingography. Depending on the necessity and the situation of the patient, these investigations, one of which are selected as a method of choice.